Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
We started to brush Marissa's teeth when she was about 2 years old, and she liked it right from the beginning. I think she liked to eat the toothpaste. Well, she'd close her mouth every once in a while and say, mmm. But we never had any problems brushing teeth. She's always eager to do it, and quite often she'll sign to me that she wants to brush her teeth.
Home dental care for children and young adults with severe and multiple impairments. A smile can reveal a lot about us. The smiles of these young people show that they're winners in athletics and that they're also winners in the battle for good oral care. Although children with severe physical and/or mental disabilities may require more attention to home dental care, their mouths can be just as clean and healthy as any other person. You as parents can help. A clean, healthy mouth starts when the child is young and is maintained at home through proper dental hygiene and nutrition. Good oral hygiene begins with toothbrushing. Toothbrushing removes sticky food and plaque which contribute to tooth decay and gum disease. Your main goal should be daily removal of plaque without injuring teeth or gums. Make sure you have reached every surface of every tooth. A model toothbrushing method is shown in videotape number 2 of the series and can be adapted according to the needs and capabilities of your youngster. In learning how to care for your child's teeth, it might be helpful in the beginning to practice on another adult, and then have that person practice on you. Chris, a supervisor at a group home, relates her experience.
The best experience that I ever had during the training that I took part in was when I had another staff brush my teeth, and I in turn brushed theirs. And we could discuss what it felt like, and that was extremely important.
When providing daily dental care, you as the parent or caregiver can play one of 3 roles. First, the parent can act as the provider, being totally responsible for brushing and flossing. This is done when the child is very young or more seriously disabled. Second, you can act as the helper, in which case both the parent and the child are responsible for some part of the procedure. You can assume this role if and when the child can be trained to use his or her limbs more effectively. And third, you can act as the supervisor. Here, the child who is older and has gained dexterity assumes responsibility for cleaning his or her teeth, while you oversee and check the process. The goal is to have the child do as much as possible for himself. The role that you play depends on how fast the child learns and how much help the youngster needs. The role changes as the child grows. A commitment to good oral care is critical since many seriously disabled children have a greater likelihood of developing dental disease than other children. Weak muscle control, poorly formed teeth or jaws, and susceptibility to disease can contribute to dental problems. Some handicapped children have unhealthy mouths because they have poor diets or because their teeth are just too difficult to clean. However, if you provide good oral care at home, problems like toothaches, missing teeth, bad breath, and decay can be avoided. In many instances, children with handicaps have the capability to brush their own teeth, but they've learned incorrect procedures which can harm their teeth and gums. Some toothbrushing problems parents should look for and correct are: your child continuously brushes on one side only. Your child's mouth is closed when toothbrushing occurs. There is an irregular pattern skipping from side to side, and excessive twisting and turning of the toothbrush. These problems can be corrected by teaching the model toothbrushing method. If you're still unsure of the toothbrushing method to use and what to do about incorrect brushing, consult your dentist or hygienist. The parents you're about to see will discuss how they provide home dental care for their children. The role of the provider is illustrated by Kevin's mother.
Kevin is 10 years old. He's a trisomy D baby. He's outlived his life expectancy by just about 9 years. He has developed to the age of, or to about the age of 6 months. He is really a happy baby. His only needs are to be changed and to be fed, and he just likes to be where there's a lot of kids and in a family atmosphere. Kevin has a lot of other problems that we've always felt were more important than his teeth until just recently. We've kind of left that to be the last thing, and I don't know why. It's just one of those things that doesn't seem really important until it's almost too late. Just talking to Kevin works to get him to cooperate and making him laugh. If you can make him laugh and get his mouth open, then he's ready to cooperate and to work with you.
Doug is 16 years old, and his mother also provides for all of his daily needs.
Doug has cerebral palsy. He was born with it due to lack of oxygen at birth. When I first began brushing Doug's teeth, I talked to a dentist about it, and he instructed me on how to do it. I used a very small toothbrush, and I had a hard time getting in his mouth because Doug was not cooperative and did not especially want to open his mouth for me to get in there and scrub. So I had to be sure to work at it diligently in the beginning. Now it comes as second nature to me because I've been doing it so long. I think it's a very important part of his care because I think it's important that number one, we keep decay out or infection, and number two, that he has a pleasant breath, and number three, that he looks nice. I think it's very important that he look nice because it helps with relationships with other people. He already has 10 strikes against him, so to look nice helps a lot.
Marissa's mother also acts as a provider, but her daughter is moving towards greater independence. As Marissa gains strength and skill, this parent will be able to act as a helper.
Marissa's 4 years old, and she was born with numerous congenital anomalies. Her motor development is greatly delayed. She's not walking yet, although she does walk around furniture and she can crawl anywhere she wants to go. She's getting to be a pretty good climber. I think I started brushing Marissa's teeth for primarily the same reasons that I started with my other children. It seemed that she was at a stage where it was important to start thinking about her teeth and keeping them in as good shape as possible. I feel very strongly about accepting Marissa for who she is and what she can do. I find if I can stay within that frame of thinking, it's the frustration level is lowered for me.
As children reach the teenage years and have gained some dexterity, they can assume more responsibility for toothbrushing and flossing. The parent of a 17-year-old discusses her daughter and her role as supervisor who only occasionally provides specific assistance.
It took a lot of patience to deal with Robin and her handicaps. The hearing loss is not too difficult to deal with, but her retardation, it's very hard to get her to understand things that need to be done. So you have to keep encouraging her and showing her, and then she will pick up on that these things should be done. By Robin being deaf, she mimics a lot of things, and it was easy for me to teach Robin how to brush her teeth because she observed me doing it. And anything she observes me doing or any member of the family, she will do it.
Toothbrushing and regular checkups are important for oral health, but so are good eating habits. A nutritionist discusses this issue.
Parents can help build good teeth and gums by providing 3 healthy, nutritious meals based on the basic 4 food groups, by providing healthy snacks, and by providing at least 4 glasses of fluoridated water per day.
The daily food guide consists of the milk group, the meat group, fruits and vegetables, and the grain group. You should avoid foods that are high in sugar content, that stick to the teeth, or those that don't dissolve easily. Such foods produce acid that causes tooth decay. Many commercially prepared foods contain a lot of sugar. Read labels and choose food with little or no sugar added. Allergies may also be a problem, and parents need to work with physicians and nutritionists to find adequate food substitutes or supplements.
Snacks, as a rule, should be limited or eliminated. If a snack is needed, I'd rather see a snack like a toasted half a muffin with cheese, a good protein food that's going to contribute more valuable food factors to the growing child.
Several parents discuss their children's eating problems and the kinds of snacks they provide.
Kevin does have an eating problem. He has a cleft palate, so he has to have strained foods. We have a food mill that we use for him.
Robin loves food and she loves snacks. She has fruit available to her at home, but she'd prefer sweets, and it increases her weight. So we've tried to cut down on the amount of sweets that she can obtain at home.
The best results occur when parents and school personnel work together on nutrition and daily oral care.
I'm the nurse at Detroit Northwest Center, which is a school for severely mentally impaired and multiply handicapped children. Three major areas of concern that we have with our children here are foul breath, food residue around the teeth, and a lack of adequate dental care. Now, these things can be handled by the parent very simply. One of the things that can be done is after a child has his meal, his mouth can be rinsed with water. He can have a nice long drink of water, and that will help with getting the food out of his mouth, plus help with cleaning his teeth and with his breath.
Many schools have oral care programs. Dylan, Barbara, and Robin are young adults who have the capacity to brush their own teeth but need further training. However, they like to be independent, and this is encouraged by school personnel. The things they need are placed within their reach. They manage to complete all of the steps, including uncapping the toothpaste and adjusting the water, but it does take time. The adults around these young people act as supervisors. They compliment them when they are finished and check with disclosing solution to see if the job was well done.
Robin goes to a school that encouraged her to brush her teeth. They did a series on toothbrushing and the proper care of the mouth. And Robin loves to brush her teeth when she's at school, and it's good for her. And, it has helped her gums to become stronger.
With head and neck involvement, there will frequently be chewing difficulty, swallowing difficulty too. And with many of these children, I think it's important that the parent cooperate closely with the therapists at the treatment centers, because the therapist may be working with that child in helping to train the child to chew certain foods like slices of apple, very thin slices of carrot or celery are good foods to begin the training for chewing, because they have substance and crispness, and the child can feel the food.
The occupational therapist anticipates having a long-term relationship with the family, starting when a child is very young, working up through adolescence and adulthood. Parents with severe or multiply impaired children, some of the best tips I have for them are, number one, begin early with oral hygiene so that the child is used to having things in and around the mouth. And early on, consult an occupational therapist or other professional about adaptive seating so that they're in the best sitting position, about muscle tone and normalizing muscle tone, and about special adaptive equipment that's available.
Adaptive devices, including electric toothbrushes and water picks, can be useful for children who have physical problems such as limited grasp and limited range of motion. These devices should be used with the advice of your occupational therapist, dentist, or hygienist. Sometimes youngsters are uncooperative. This problem can be especially acute if they have not had the experience of oral care from an early age. A supervisor at a group home describes how some young adults react.
The reactions to this toothbrushing varied a great deal. We'd have a few residents that were accustomed to a toothbrush and knew that it went into the mouth and knew that you manipulated it, but needed help getting all surfaces and that sort of thing, helping rinse the mouth out and that stuff. The rest of the residents, it would vary. Some were very much opposed to the whole thing and would not even open the mouth. Others would open the mouth for a very short period of time and then clamp down, and that'd be the end of it. So it took a long time to brush those teeth. Do a little bit and then stop, a little bit more and stop.
Toothbrushing can sometimes be made easier by varying the position you use to brush your child's teeth. Holding your child in a firm yet gentle manner provides support and comfort, especially when there are uncontrolled movements. If your child is large, somewhat uncooperative, or has excessive head movements, then seat him or her in a chair and stand behind the child. Use one arm to cradle and support the head. If your child is uncooperative or needs support for the arms and legs, then seat the child on the floor with his back to the chair. You sit in the chair and cross your legs over the youngster's shoulders. If your child is very young or in bed for a period of time, position him or her on the floor, bed or couch, then lean across the youngster's body or stand by the child's head. If your child is young or moderately disabled, place him on a couch with his head on your lap. If your child is particularly resistant, then you may need two people. As your child learns to accept home dental care, the need for such restraint will disappear. Combined with our work at home, the dentist plays an important role in maintaining your child's dental health. Regular checkups are advised once or twice a year.
First thing that we'd want to do is to secure a very adequate health history, including the medical, the dental, and the behavioral characteristics of the child as far as they're known.
How much will your child understand when the dentist explains or shows something? Can your child sit in the dental chair without help? How much control does your child have of the mouth, head, and neck? How do you get the child to cooperate? You may find it difficult to find the right dentist for your child. Some dentists are uncomfortable about working with a person with handicaps. Sometimes the youngster's physical or behavioral problems present such difficulties to a particular dentist that he or she cannot work with the child. If you encounter such problems, contact your local district dental society, nearby dental school, or parent organization such as United Cerebral Palsy or Association for Retarded Citizens. You may find it necessary to try out several different dentists until you find one that meets your child's needs.
We took him to our family dentist, and he said he could try to take care of Kevin, but he wasn't sure that he could do it, but he would try, and so I wasn't really excited about trying to take care of it, trying to pull a tooth. So he found a dentist that would go up. The office was in the basement, and we had to carry the wheelchair down 2 flights of stairs. So that was, and no elevators, so that was a problem.
You may be afraid to take your child to the dentist office because you don't know how your child will act there. You may also be concerned about how others will react to your child. You'll need to arrange office visits so that your child will be the most cooperative.
As you come into the office, please do not be embarrassed in relation to other families who may be waiting. We, in our office, intend to see a handicapped child on regular appointments, just like we do all the other patients who come to our office. We in the dental profession are here to help you, the parent of the handicapped child, the best way possible, presumably with the emphasis on prevention rather than on treatment.
One of the ways a dentist can be helpful is in the management of medication. You should ask about the possible side effects of all medications that are prescribed for your child, since some medications affect the condition of the mouth, gums, and teeth.
When Doug was 4 years old, he had to have a gingivectomy, which meant he had to have his gums cut back, upper and lower, to allow his teeth to protrude through his gums so he could eat and chew his food properly. His gums had become this way since he had been put on Dilantin, a medication to control his seizures. Now, sometimes doctors who care for seizures won't worry about this, and sometimes doctors who care for teeth cannot order these medications that control seizures. So it's very important that the parents make sure both doctors know what's going on.
Often, though, gum disease can be controlled even with a lifetime use of medicines such as Dilantin. Daily brushing, flossing, and massaging can reduce the likelihood of this problem. Frequent rinsing with water is also advised. Youngsters with severe multiple handicaps may have a variety of specialized needs. In the hospital, the pediatrician deals first with the medical problems, and then begins to work towards learning and psychological issues for the youngster and the family.
I think the important thing with any kid, whether they're handicapped from birth or handicapped because of an accident later or an illness later in life, is parents need to know completely what's going on. Our philosophy here is that parents and kids are part of the team.
As the parent of a handicapped child, you have many responsibilities concerning health care. Some of your child's problems are difficult to solve. However, good oral care at home is one area in which you can make an important impact. This can mean fewer medical and dental bills, a more pleasant appearance, fewer chewing and speech problems, and greater social acceptance.
I work with Marissa pretty much the same way that I did with my other kids, and that is showing them what I want them to do and then giving them a chance to try it themselves. She gets a lot of positive feedback from us around here. We're always giving a lot of hugs and a lot of good girls, and so she knows when she does something well.
The patience and the time and energy that I put in towards Robin's dental care has paid off because her gums are stronger for the few efforts that I put towards brushing her teeth myself, and she has a beautiful smile.
These parents provided home dental care for their children, and it paid off. Your efforts can too. Remember to brush your child's teeth at least once a day, preferably at night. Provide fluoride either in the drinking water or through supplements. Visit the dentist regularly, approximately once every 6 months, and avoid sweets. Your child can have a healthy smile that will last a lifetime.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.